Today we have with us Dr. Ashish and he is practicing in Rajkot, Gujarat. We will be covering the topic of BPH because that's very important aspect and we need a discussion with the doctor, of course. So very welcome first of all.
Yeah.
Why according to you are the cases of BPH on the higher rise these days?
I don't think BPH is on the rise. Let me clarify it to you.
Yes.
BPH it occurs in each and every male. So the number of population, the people rise, the BPH amount would rise. So any person after the age of 40 would have changes in his prostate, and this occurs in 100 out of 100 patients.
Okay.
Maybe only say 20% of those would lead to an obstruction of the prostate and lead to obstruction of the urinary flow. And those are the patients that we need to treat for
Yes,
BPH. So BPH is universal.
Right.
Right, so since the prevalence is 100%, so the things that I would like to tell people who are connected through this medium is get yourself evaluated. People think that the reduction in flow of urine is part of aging.
Right.
They accept it and they move on in life, and they come to us at a stage where there are a lot of complications.
Right.
So I would suggest that yes, if you have noticed a reduction in flow, if you have noticed there is a difficulty in urination, you notice that you need to go more, there is a nocturnal frequency of urine, yes, you need to consult a doctor.
Right.
So I would suggest, yes, if you are primarily connected to your family physician, meet him, get certain basic investigations done. We need a basic evaluation when treating a patient of BPH. So that would be a basic rectal examination, a sonography, a uroflowmetry, and a PSA examination. These are the basics that I would suggest to any patient who's thinking of getting evaluated for BPH.
Well, so what makes it very important for a patient to make it diagnosed at an early stage and not delay the process?
Okay, so two things. One is of BPH. Maybe 5 to 10% patients develop a malignancy or a cancer of the prostate. So when the patient comes first for an evaluation to us, first thing that we would like to rule out is a malignancy. We should not rule out, we should not miss a prostatic cancer. So that is done by a rectal examination and a prostate specific antigen. It's a blood test.
Okay.
Once we have ruled that out, okay, so this patient is non-malignant and he is a primary BPH patient. Then the earlier he comes, there are less of bladder changes. Imagine it's a water pump and a pipe. And if the pipe is blocked and you keep the water pump on, what happens to the pump? Over a period of time it deteriorates, right? The same thing happens to the bladder.
Yes.
Bladder is a muscular pump. So the more delay there is in treatment of BPH, there are more bladder changes. These are permanent.
Right.
They don't recover. So in that case, the BPH treatment should be started at an appropriate time.
All right. So what are the severe complications a person might have to face when it's too late and
Okay,
at the very
there are four or five complications that
Yes,
a patient should be aware of. The first thing is retention of urine. So
Okay.
his urine stream will completely stop. He would have severe pain in his abdomen. He is not able to pass his urine. This is the first complication. Second, as I mentioned, that because of residual urine in the bladder,
Right.
he can develop a stone in the bladder. A large stone, and sometimes it's such a spiculated stone that it causes a lot of pain and dysuria to the patient.
Okay.
Beyond this, if it goes and the patient has still not got treated, then that pressure mounts and goes up to the kidneys. So then he develops dilatation of the kidneys, and then he can develop kidney failure. So from a simple BPH, it can land up into a patient with a kidney failure. And the patient would have come to me with a normal creatinine of the kidney, say around 1.2. The patient would come with a creatinine of 8 or 9, just because he didn't get his BPH treated on time.
If any of your case you can recall and tell our viewers,
BPH is
most challenging case of your life when it comes to BPH.
In fact, BPH, I tell patients to get treated on time. The reason being is this.
Yeah.
Suppose a patient is 65 years of age.
Right.
I've suggested certain treatment, maybe say at the age of, I've advised him a surgery for the BPH. He doesn't get it done. At 72, he gets a heart attack.
Okay.
Or he gets a brain stroke. Or he gets Parkinsonism.
Uh-huh.
And at that time, his prostate goes into retention. So at that time, how do you treat this patient? He had a window 2 years back, which was the ideal time for him to get it treated. He didn't get it. Now he has 2 or 3 other comorbidities. So the more number of comorbidities, the more challenging the patient becomes.
Right.
I would talk about a patient, say, who had only a 15% ejection fraction of his heart. We had taken a consent of death on table and operated upon his BPH.
Yeah.
So we face such patients just because of lack of knowledge in the society and inappropriate time for starting the medication.
So when does the surgical intervention becomes a necessity, and is there any chance to avoid it?
No, there are very good medications for BPH. Say out of 100 patients of symptomatic BPH, symptomatic means the patients who require evaluation and treatment.
Right.
Majority can be managed by medication. We have very good medications right
Provided
now.
they come early.
Provided they come early and they take those medicines regularly. And we keep them following up by a test called uroflowmetry
Yes.
and a urodynamic study. And at a stage comes when the medicines are no more effective, or the patient is becoming more symptomatic, or his bladder is showing dysfunction.
Right.
That is the time that we need to shift him to surgery.
Do we also need to take care of our lifestyle modification when it comes to the people aged 40 to 50?
Yes, it's certain. See, BPH is inevitable.
Yeah.
Just by lifestyle modification, you cannot prevent BPH.
Of course.
But a very active, healthy lifestyle, prevent obesity, high vitamin C in your food, normal sexual activity. These are all methods where BPH remains a little under control.
Right. Any take-home message for our viewers?
Stay healthy, stay happy.
Thank you so much, sir, for your precious
My pleasure.
time. Thank you, sir. Thank you.